Hi everyone, and welcome back to another Live Well podcast. As usual, I'm here and I'm joined by my lovely co-host, Sasha.
Hello.
Hey. And then, although Sasha is here with me, we also have two experts because they're doctors. By the way, the more I do this show, is the more I feel.
It's a sign for you to do your doctorate.
Because doctor. So clearly it's a sign for me to change my life. But I'm surrounded by Dr. Garrett Fairclough and Dr. Ejay Charles. Both are general practitioners here in Jamaica. Actually, one is a Jamaican and one is a Trini.
Okay,
so
finally some representation.
So before we go into it, I'm going to ask the doctors just to give us a quick overview, insight as to what they do and a Jamaican a greeting in, just for fun's sake, just a greeting in our language.
Okay, I'll go first. As the Jamaican, Wagwan Jamaica. All right, I'm Dr. Fairclough, and I have graduated from med school in 2016 at UWI Mona campus. And I've been in emergency medicine and now general practice. So emergency medicine is everything: gunshot, stab up, cuts and bruises, car accidents, and now a little bit more laid back in the private world.
Okay.
Nice. Where's the scene, everybody? Where's the scene? For those who don't know, that's the equivalent of Wagwan, right? My name is Dr. Charles, Dr. Ejay Charles. I am a Trinidadian, born and bred, and I came to Jamaica 11 years ago, August 19th, 2013. I'll never forget that day. I currently practice at University Hospital, and I graduated from medical school here in Jamaica in 2018. So I'm a surgical resident at University Hospital. I'm an orthopedic surgical resident. So, yeah.
Okay. Nice. Okay. Before we dive into the discussions, because as I said, the conversations will be surrounded. Awkward conversations, awkward visits to the doctor's office. We've all had them. There's some burning question where it's like, well, I can't ask my doctor this. I'm going to know how to ask him this. What is he going to say? Am I going to feel judged? Not going to know my deeds, what I'm up to. All type of things. Mm-hmm. And then sometimes we have some of the silliest questions because we don't know the answer to them. And then we feel bad about asking them, but we want to share them now to see what are some of the things that you would people share with you and how you answer them. Mm-hmm. But before I do that, it's an important question I always like to ask doctors. Why did you decide to become a doctor?
We need to know this before we continue the conversation. If your reason is wrong, you'll have to leave this.
Correct. So, Dr. Charles, we're going to start with you.
All right. So, I remember in 2012, I wanted to be a vet initially, right? Vet. And then my friends were all applying for medical school. And I was like, I can do this too. I can do this. This is human medicine too. Okay. And I applied.
I can do human medicine too. Peer pressure turned up.
I am telling you exactly what happened, right? And if my friends Hugh and Ian watching this, I remember that day when they were applying. I said, I can do this too. And I applied for medicine. Mm-hmm. And from that day, I started to research and do different things. And initially, I wanted to do pediatric medicine. Mm-hmm. But then that has since shifted, being in medical school. So I now practice adult orthopedic medicine, surgery.
Okay. So you don't want to go back to the animals, no?
I mean, I love animals as pets, so I always take care of them at home. But, for a career, I like the human interaction. Yeah, man.
Fair.
All right.
Wait, we accept that?
You have to accept that.
Do we?
No,
animals.
Because you can say it's really peer pressure.
Positive peer pressure.
Positive peer pressure.
Okay.
That's what to say. So we can accept
All
that.
right. Okay.
It's interesting though, because my story is very similar.
Oh.
I wanted to be a vet when I was younger, and funny enough, I went to the vet to cut a puppy's tail, right? You know, dogs, I don't know if that's in Trinidad, where they cut the tails to give them a look. Mm-hmm. And I fainted. And I said, I can't do this. I can't be a vet. And then similarly, what is the next option? Let's try humans. And strangely enough, I've
did
done
not
much
faint.
worse now.
But I was just about to ask if
Right?
worse than cutting a puppy tail, I would imagine.
I am okay now. But a big part of it is also you feel like you make a difference, especially in emergency medicine when somebody comes in mashed up from an accident and they leave walking out happy.
Understand.
So that's the part of it too.
Okay.
That sounds like, the Miss World answer. How do you want to change the world? World peace.
Yeah, no, I think that. It also gave me a vibe of Purina. Like, they should probably be attached to Purina somehow,
All right. The second question, I've often noticed it, and I think the pandemic also showed it up. So before we go into the awkward conversations, why doctors stay so bad in taking care of themselves? Like, you guys will give to the world. You guys will save the world. But I find that doctors often don't take care
You
of
find so?
themselves. Yes.
Because to me, I always seen doctors on vacation
no,
and doing all kind of
I
things.
don't know what kind of doctors you see.
Oh, okay.
Trinity doctors?
No, they hardly eat. Them don't like
Yeah,
exercising.
that's true.
Always on call. From what I know, they don't really get paid that well.
They are givers.
Doctors are the worst patients. That's the truth. Because a part of it is almost like it's supposed to be selfless. So if you complain, it's almost like it's making it about you and it becomes selfish. So if somebody is sick and you're like, I'm tired too, you don't want to hear that.
Yeah.
You have to just do your best.
Yeah.
And COVID highlighted that, magnified that for everybody in medicine. And not only doctors, nurses, other healthcare workers as well. It's been rough.
Yeah. It's one of those unforgiving professions, but yet you guys do it, and on behalf of a grateful, not only nation, but Caribbean. Thank
Yeah.
you so much for the efforts.
Yeah.
As I say in the US, thank you for your service.
Thank you for your
Yeah.
Okay, so we're gonna dive right into the discussion. Sasha, I don't know if there's anything else you want to ask Docs about.
No. I'm really looking forward to this conversation because I feel like we have a different slant with it being two Caribbean countries being present, and the role that culture has in the stigma attached to it and the misconceptions. We have to weigh tradition versus, Western versus, whatever you want to call it.
Yeah.
But yes, I'm really looking forward to this conversation. So.
Okay, so
Yeah.
I'm gonna dive into it from a perspective of a patient. I'm a patient. How can I approach you to have an awkward conversation about my health? Or like, how is that approach normally?
Well, to be honest, I think the perspective then in the past when you were a doctor is different now. So you can see we're younger doctors, right? So we kind of understand some of the newer awkward conversations you have with the doctor. So if you're older, you tend not to understand social media, understand the unique, I want to say, sexual and reproductive health questions that patients might ask. So I think for me at least, being somebody who can relate helps. So going to your doctor and being like, oh, the doctor don't look stuck up. The doctor don't look
Far removed.
far
or out of
removed.
touch.
The doctor don't look like he's putting on this air of, you're my patient, so listen to what I say. I feel like those things help. And being able to be seen, visible, whether it be through social media, on other platforms, helps as well.
So we spoke about earlier in one of the episodes, being seen and the importance
Being
Yeah.
seen.
Nice.
Yeah, I agree. I can actually second what he just said, because it's not just, when I was growing up, I never had any doctors in my family. So first one to go to college and receive a doctorate. So I always see doctors like, these people up there,
Yeah.
and now I am in that position and I don't see myself as up there. So I'm hoping that my aura, my personality comes through in my practice, and hopefully the patient can be open enough to discuss anything. Again, we're younger. I see what's happening on social media, so it's bombarding me the same way it's bombarding the patient. So I can kind of relate to it, as opposed to this kind of generational break where when I was 16 and I go into the doctor who's 35, I am in social media, he's not.
Yeah.
But now I am 30 and my patient is 16 or 17 or 18. I'm in the same social media as them. So we kind of share this whole social media and basically like an evolutionary experience.
Yeah.
Added to that, I think the environment that you provide as a doctor really and truly allow your patients to open up and be open with you to share things. If it's a 25-year-old with their boyfriend or their girlfriend in the office and they want to ask certain questions, those questions may not come out. As opposed to a 17-year-old in the office with you, with their mother, versus by themselves, the questions definitely won't come out. So you, as a doctor and Dr. Fairclough, would definitely agree to this. Sometimes you just have to ask or find creative ways to ask the parent or just to segregate the
exit.
Even the adult from their partner. To just,
Step out.
you might be hearing a history that is just very suspicious. Boyfriend and girlfriend come, and the history is suspicious, So you just have to ask them just to step out and, and that way you can kind of allow the awkward conversation to flow.
But I have a question though, and I feel like, Gaffin, you forgot to mention that I am in charge of this podcast as the only female amongst the men here, right? So my question is, as it relates to the awkward convos, right? Do you guys think that there is a difference based on gender? Because I am thinking of the two of you guys, right? And I'm thinking of myself. So let's say I am looking for a gynecologist, right? Do you find women being more hesitant to interact with male doctors as it relates to, like, let's say sexual or reproductive health? Because I know, like, sometimes, you'll see on Twitter somebody saying, hey, looking for a female gynecologist, like they're very specific about the gender. And I would assume, based on, having been in that position myself, that you want to avoid the awkwardness of having to interact with this random male as it relates to your lady parts and, that kind of thing. So have you guys ever experienced that awkwardness based on gender?
It's interesting though, because I feel like there are women who prefer a male.
Yes.
Because they feel like the male would be more objective and not necessarily pass judgment in a sense. And there are females who prefer a female because they can relate more. But what I find that's happening now is that most people are looking for convenience. So if you're not in with the new, being able to be accessible, being able to really have an innovative kind of care, people are more thinking about the service than the actual gender.
Okay.
So if I can go to the doctor and I'm in and out in an hour or less, I'm good. If I'm there for 5-6 hours, you're wasting my time, right?
Yeah.
So I feel like it's shifting, partly due to social media and what's happening in the world. So right now you can go on TikTok and you can find people talking about health and wellness. You don't know if it's credible, but people are listening, right?
And funny, that's the way in which in this younger generation, that's how they consume.
Absolutely, health and wellness. Yep.
And that's how they find physicians now, on social
Absolutely.
media.
On social
You're
media.
choosing a doctor based on the number of followers.
Popularity.
Okay, popular,
Which may not be bad. It depends.
It depends.
Because that's, as we know, health and wellness is important now. And also the chronic stuff, chronic illnesses will change based on what decisions you make when you're young. So if your doctor is with it and doing what you're supposed to do and you can check credentials, why not?
Yeah, it's a perfect segue into finding your healthcare provider. Doc, do you have anything
No,
else?
man, I agree. Nothing else. You said it perfectly.
Okay. All right. One of the things I want to find out. So you mentioned the awkward questions that are being asked. I'm going to be the one to say, can we share some of those awkward questions? What are those things that people come in there and ask? Like for me, I don't really have no awkward questions. Like, me and my doctor, we're cool, we're chill. Like, anything I want, I ask her. So, from my perspective, there's nothing I can really think about right now that I would not ask my doctor. But you guys are here. You can help us shed some light on it and see how people can. Because, again, people go to the doctor and they still have the issues with them. And they leave the doctor's office and they don't ask. And then they go home either they suffer in silence or
they Google something and try to treat themselves. Okay, Dr. Google.
That don't work.
You're correct.
Or them go home and drink tea. And we know that's not the case.
And not just any tea, ginger tea.
So what are some of those questions that people ask?
Boy, listen.
Doc, when they don't look like they don't want to share that.
No man. So the thing is, it depends on which spectrum we're talking about, right? So it have from the gasping, it have from the young kids who just starting having sex. Things like, Doc, can I use 2 condoms? I want extra protection. I would like to make sure that I don't get a girl pregnant, so I want to use 2 condoms. So at that time, no, it's
Can you? Is that more effective?
absolutely not. Let me look at the camera. Absolutely not. Right. So, and the principle behind that is because latex on latex, and that will cause extra friction,
yeah.
and it will burst. So, in you trying in an attempt to,
You knew, yeah.
yeah,
Okay,
in,
okay.
in an attempt to protect yourself more, you're actually causing more danger.
Danger,
right?
okay.
And another thing is that can I reuse a condom or can I wash it out? You know, and those things.
Question, stop. So that's an actual question that has been asked.
Actual
Of course.
questions that has been asked.
But is it okay? So let's talk about these what do you call these things?
What? I don't know.
The socioeconomic stuff. Let's talk.
Okay.
So do you think?
I was thinking about that.
Yeah. So is it that those questions are based on your socioeconomic level, or is it people genuinely want to
Don't
know?
know.
Yeah. Is
Yeah.
it that they genuinely don't know, or is it a matter of, hey, I want to be safe, but I also want to have a lot of sex, but I can't afford to buy a condom each time. So
Right.
what do you see?
I think it's most, well, the situations that I've encountered is more so the latter. So I've had patients who come to me and said, Doc, I have one condom, right? And that night I wanted to do it 2 times, right? But I had one condom. 2 times, 2 different persons, right? And yeah, that's my reaction too. And so
Same
they were thinking,
Gross.
they were thinking that they can, instead of having one protected and one unprotected, they were thinking that they can
Double
just
up.
use one condom, rinse it out, and then use it again. So at that point in time now, you have to educate them. One, you have to educate them where they can get condoms so that they always have
Exactly.
condoms.
Right.
So the government will have different initiatives, different drives that are free, right? And they'll teach you how to use it, etc., etc. And then they would then you can educate them now, knowing that to have some level of self-control, because if you have one condom and you don't want to expose yourself to HIV, STDs, and different forms of the diseases, you would have to exhibit some self-control that
Yeah,
night and just
yeah.
do it one time, right? So
And
those
that's anything in life.
Yeah.
right?
You
Anything, yeah.
can't, you can't drink 5 glasses of wine.
Right. Well,
Can.
Yeah.
But
Yeah,
know the
yeah,
repercussions.
yeah.
Right,
Correct,
right,
yeah.
Right? And it's not about you alone in that situation. You're exposing somebody else who doesn't know.
Yeah, correct.
And I guess that's why, in terms of sexual health, you should be actively involved, both persons. So you should see the person, tear the condom, take out the condom, ensure it's put on. Because people are devious and things happen.
Yeah, correct.
So if that person's reusing, you should have seen that it was just taken out.
Yeah.
And just put on.
Yeah.
You know?
Yeah.
But it's an interesting thing. I think the socioeconomic stuff do matter because, to be honest, some people are just not educated.
Correct.
And generational thoughts do get translated from one generation to another.
And we spoke about that, yeah. The
You know,
trans.
so if I think ginger tea is a cure-all, be-all for my gas pain in my head, my foot, my knee, my
And
back,
what my granny tell me.
I am going to
Yeah.
take it.
Yeah.
And then there's some psychological aspects where you feel better because
Yeah,
you've been
like it
told
works as a placebo
The
kind of
condition
thing.
it's a placebo.
Yeah.
You've been told that it works. So you drink it and you just bust a big gas.
Yeah. And it feels better.
You
Yeah.
know? But you always be guided by evidence-based medicine. We can use some of these
Yes,
things.
Google.
But Google, you can Google responsibly.
Yeah, you have to know the websites that you could use. So like your
Yeah.
WebMD, your Harvard,
exactly.
but
You
you're
got
not going to go on www.ilovehealth.com and be like, wow, this doctor said this, Yeah.
Or going on Facebook and just find a blog and you just reading, and you hear this
Yeah,
person say
yeah.
it work and that person say it work.
Yeah.
And going back to that question, another thing that I've heard, and it's so shocking to me, which is a topical subject, abortions, right? But people using rusty nail with warm Pepsi to induce abortions. And this is something that does happen. People drink it
in this current day.
in this current day.
Wow.
And they do think their grandmother has told them it does work. So I'm going to try this. And boy, sometimes they come and it seems like it works, but it must be something else. That's
Yeah.
not scientific. That's not proven, and that's unhealthy. It's a rusty
Yeah.
nail with a lot of infection.
Wow.
But people do that.
You drink. Hold on. You.
So you warm the Pepsi. You get some rusty nail. I don't know where you find the rusty nail, but I guess you look in the yard. And you put the rusty nail in the Pepsi, you shake it up, and you drink it.
So you're drinking Coke and tetanus. That's what you're
That
drinking.
is exactly
Yeah,
it.
yeah, yeah.
But
Is that rum and coke?
Yeah. That's actually crazy. And it's
people
funny
do.
because you would think that what your grandmother says is
It's
gospel.
gospel.
You know, you're not going to consider that. So at this point,
You dare
the
not
doctors
contest
know
granny.
this work. They just don't want you to know because they want to take your money. But granny
Exactly.
know you could just buy a coke and find
Buy a
out nail in the yard, as you said, and
And
it's
just
a
shake
cheap
it up.
solution.
Cheap
So
solution.
wow. So
And
the
you dare not
misconceptions.
contest
Yeah.
granny.
Of course.
Dare not.
Of
Okay, all
course.
right.
Yeah.
Granny is the local web MD.
Yeah.
So Granny is.
Yeah.
So-
Wow.
I get all of that. So when you have a patient that comes in and asks all these questions, first of all, I know I probably wouldn't be able to keep a straight face. That's one. So it's not to say I probably would laugh, but on my face you probably
Confusion.
see that correct.
Yeah, I'll be like, I am confusion. What?
So how do you as medical professionals tackle these misconceptions? Like, what do you do?
So listen, Garfin, Sasha, it takes time, right? we are human beings just like you guys, and it takes time. The emphasis being on the word professional. So sometimes you genuinely see a patient come into the office with a straight face. Say, Doc, I took the rusty nail with the Pepsi for the abortion. And they're genuinely asking you a question. So at that
Yeah.
time, the confusion is going on in my mind, but I can feed off this patient's vibe or aura.
Yeah.
And I can say, okay, maybe it's a prank, or maybe it's not a prank. If it's not a prank, then you have to address it. And you have to
Yeah.
address it gracefully,
Of
so that the
course, yeah.
patient doesn't feel attacked, so the
Yeah.
patient doesn't
Or offended.
feel offended. That's where. But I must say that the with the advent of the mask, it definitely did help in terms of controlling.
Yeah, controlling.
Yeah,
Wow.
So you can't see.
Yeah.
But I think to some level of sternness is necessary sometimes.
Right.
And depending on the age and the generation, sometimes a younger person, you may need to be a bit stern. And as you were saying about the socioeconomic stuff, sometimes these persons don't have a parent figure. These persons don't have reliable sources for health information. And sometimes if it is something that is life or death or threatening to your health, you may have to be stern, right? And the sternness doesn't have to be disrespectful.
Of course.
It's just that you are telling this person that this is not acceptable, it cannot be done. And bear in mind, people are sometimes adamant that this works because
Yeah.
you tell them granny.
Yeah.
And granny knows stuff, right? Or whoever in the community did it and it worked,
Yeah.
right? So sometimes the patient still leaves with a thought that this may work, but it's just to educate them and give them all the resources. They may not want to hear it from you.
Yeah.
Say, okay, go on Google, find this site, read, right? Go on this association, go to your health center, get more information. So there are a lot of resources that are
Can
out
be
there
used. Yeah.
with guidance.
Yeah, no, I agree. And that's what I was saying this morning, Garfin, when I was telling you all about my passion for health education. I feel like health education plays such an important role because sometimes these misconceptions or misperceptions can easily be debunked, I guess, with just the correct knowledge. So it's for lack of knowledge. It's not that they literally trying to be difficult for the doctors
Yep.
or anything. It's just
Yep.
they genuinely don't know. And I mean, for me, the cultural aspect is so important because if it worked for somebody else, it could work for me. And these cultures, they work for at least one person anytime, but we
Yep.
need to educate persons, even these taboo topics, abortion, sexual health. There's no reason that we shouldn't have fluid conversations like this about them all the time. People need to know. Everybody having sex, okay, no, not everybody can get pregnant. Females can get pregnant. Yeah, but these are not things that are limited to any one group of people or any one country or anything.
Yeah,
you know?
but you said a lot of people aren't having the conversations, the fluid conversations. What's the reason for that, do you think? Is it shame?
You know what I think? I think it's a matter of culturally, certain groups are underserved. So if you were a woman who is pregnant out of wedlock, there will be certain thoughts. So you're going to try everything to get rid of that baby. If you were a child, the child health policies weren't as robust as now. So certain groups tend to be kind of stigmatized.
Yeah.
So you find alternatives.
But let me be devil's advocate. You think that's a misconception as well? That a single mother pregnant out of wedlock she might say, I'm not going to the clinic because people will watch me funny. But nobody actually taking her on. So is that a possibility as well? That in itself could be a
I think
misconception?
culturally, people talk.
Back in the society. Yeah.
They're going to say, say she's pregnant. People talk.
Okay.
So, and word gets out. And that's the next thing too, thinking that your doctor is not confidential. So thinking that when you speak to your doctor, doctor going to tell the nurse going to tell somebody else, and then all of a sudden the nurse knows somebody in your community and it reach there.
What if the doctor is friends with your friend? You can't
And
go
the
to that
doctor is
doctor because
friends
then
with
your
your
friend.
friend, you know?
Yeah.
So I think also having that environment people feel like they can trust and have confidential information is important. So I think that's one of the reasons. It's just that yes, there's lack of education, but it's just stigma with certain things like sexual health. How many of us spoke to our parents about sex?
I did.
You did?
Well,
Yeah.
that's unusual.
Yeah, I did. But
No.
okay. 1 in 4.
Exactly.
Again.
And that's probably an actual ratio.
probably-
That's probably an
And-
actual
yeah.
ratio.
And I was just about to. I was thinking while you guys were speaking a while ago, and I was thinking, is it that the people, is the particular type of people, is it that is non-educated or lack of education? When
Yeah.
education in its formal sense,
Yeah.
but not necessarily, because we are all educated here.
Yeah.
But we didn't have that conversation with our
True.
parents. Just
Yeah.
kind of had to find our way. So I would not be surprised if an educated somebody, this is smaddy,
Yeah.
Welcome to Jamaica now.
I educated somebody come and say, Doc, I finished UE. I am a UE grad. I have my master's. But Doc, that abortion with the Pepsi and the nail.
Yeah.
Doc, can I try it?
Yeah.
So it's obviously this person has the capacity to understand.
Yeah.
But were they exposed?
Based on the socialization.
Right? Were they exposed based on primary or secondary socialization?
Yeah.
And that exposure now, was it their fault or was it society's fault? Was it their fault in terms of they never really around the vicinity of the information, or they never captured it, or they just scroll past this video on social media?
Yeah.
Or is it
It's not
that
affecting me right now, so I don't need to.
right? So until it kind of reaches at their doorstep, then they kind of take it on.
Yeah.
But as you said, that's why visibility is important. So now you can literally find information, multiple sources.
Yeah.
You can check credibility.
Yeah.
And you can now decide, this don't make sense, that makes sense.
So fact checking.
So, and
is
fact
important.
checking is important, right? Versus before there was no social media. So you get
And you can't
information,
ask
you can't ask.
ask.
Exactly. So it's desperation.
Because
you're
long time that
doing.
offensive, bring it up with older folks and it's offensive. Yeah.
So your friend might tell you something, you say, no, say she tried this, try it. In desperation
Yeah,
leads you to do it.
correct.
Yeah,
You know?
for fear of persecution as well,
Yeah.
based on the times. All right, someone mentioned, I'm going to ask, it is probably one of my questions that I would ask the doctor, yeah? Someone mentioned, Sasha, was it you? Ginger tea?
Yeah, me.
You sound like you drink a whole heap of ginger tea.
I don't like
I'm-
ginger.
You know, for somebody who don't like ginger, you know not about ginger
No,
tea.
it's true.
She's Caribbean.
Yeah.
So is tea a cure all? Doc, I have little gas, I have my chest hurting me, or is gas during some ginger tea. I have a pain in my back. You know, my granny said it's becoming to eat today.
Can we debunk one thing
Yeah.
quickly?
Yes.
Quick and fast.
Sure.
Debunk it quick.
Quick and
Quick.
fast.
You can't get gas in your head, in your knee, in your
your shoulder.
joint, in your foot back, in your back. Gas,
You
if
cannot.
you're going
I
to
just wanna-
say gas,
cannot.
is indigestion. So that's in your stomach.
Okay.
So you have some issues with digestion. That's what gas basically means.
Okay. So there's a
Right.
proper way of saying that we have gas.
Yes.
Yeah, you have indigestion or heartburn if you don't want to use that word, right?
And it can only be in one part of your body.
And
Right.
one
Yes.
part.
One section, as I
One
say,
section,
right?
yeah.
Which is from your mouth to your anus.
Right. Yeah.
So all the other parts, you need to check your doctor, right?
And I will say at this point, I have had patients come in my office, right? And or my little clinic area and say to me, Doc, I have gas in my shoulder. And they would proceed. And
explain
no,
to you.
no, man, they would proceed to hit the shoulder. Boop, 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 and then burp. See, you see that?
Yes,
see it
yes,
there.
yes,
Oh,
yes.
for real?
See it there, right?
I must try that.
You cannot convince them otherwise, you know. Or they will say, Doc, it's in my knee, and they hit the knee, pop, 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 and they'll burp.
Wow.
And you
And it travels, remember?
And yeah, the gas moves, you know.
Well, that makes sense. When you knock it, it moves. It travels.
moves.
Where will travel from your
No,
shoulder?
it
Come so.
shoulder, no, it just come from your shoulder and it translate from your finger to your mouth, you know. Yeah.
Okay.
You're being sarcastic, guys.
Yeah,
But
yeah.
yeah,
Interesting.
they cannot
interesting.
convince them otherwise.
Yeah.
So this is a very, very, and this is not a Jamaican thing.
No,
This
it's
is a
I
Caribbean
realize
thing,
because
yeah.
nutritionists agree.
We, yeah,
This is a
yeah,
Caribbean
yeah.
thing.
But the ginger tea and the tea on a whole is not just for gas too, when you have menstrual cramps, tea.
Oh, it's true.
When you have a flu, tea. When headache, tea. Actually, yeah, like almost everything, tea before medicine. You know?
Well, I don't even think it's the actual tea itself. What I, based on reading, is more something warm in the
Warmth.
tummy
Absolutely.
or heartburn that
Right.
helps to relieve that gas, right? But as it relates to the gas elsewhere, it's a placebo effect.
Right.
But
So
there's
then
no
tea is a
gas.
cure all because there's the warmth. That's what we're saying. That's what we're getting at, guys.
So go ahead.
Go, Doc.
Right.
I'm gonna segue into something. So
Right.
you
So
continue.
what Dr. Fairclough was mentioning about the gas, you told me you might ask yourself, so doc, why? Why do I have gas? Right? So the simple answer is that there are good bacteria and bad bacteria. It's called flora and fauna, as they say, right? In your stomach, right? Throughout the entire alimentary canal. That's from the mouth to the anus. But it kind of congregates, I should say, or it's concentrated in your stomach. So when you don't eat on time, what happens that these good and bad bacteria, they just kind of proliferate. They just get active and start to
like a
dance, you know?
dance. Yeah.
Right. And sometimes they release gas, right, in the stomach, right? And this gas is what you feel. You feel bloated and you feel kind of uncomfortable. And after a prolonged period of time of not having proper diet, or you have an proliferation of this bacteria, it's called H. pylori. Then you start to experience now burning. So it moved from just bloating to now burning in your stomach.
And then it moved
And then-
to my back.
No man, this burning in your stomach now would just result in a more long-term kind of pain. So every time you eat, you feel bloated, you feel gassy. And you might say, oh, I don't want to eat because I'll feel more pain. And then you have more gas. So it's just like a vicious cycle.
Cycle, yeah.
Right? So the truth is now you just have to take care of your gut health, as they call it.
Yeah.
So what they recommend, over the counter, you can go to the pharmacy,
Probiotics.
buy probiotics. You can eat foods high in probiotics and prebiotics.
Like yogurt.
Yeah? Like
Great.
yogurt and
Yogurt.
kale and all those
Yeah.
nice things.
Your antacids.
Right.
Does that in any way affect our mental capacity or mental health?
Being hungry?
No, having that the gut
health.
the gut health that Doc
So
spoke about a while ago.
I've been hearing things like that on social media, and there are a bunch of studies and new studies talking about you should take care of your gut health. Your gut kind of affects everything else. I haven't delved deep into that, but what I can tell you is that if your gut is unhealthy, it means that you are not digesting food as you should. Meaning that you're not absorbing the nutrients from your gut. Right? Because after some of the food is digested in your stomach, is absorbed through the small intestine, the large intestine. If that area is unhealthy, meaning that have a bunch of the bad bacteria, or you don't have the capacity to absorb the nutrients, you genuinely will feel worse. Meaning that you may not feel worse right away, but over a period of time of not getting those micro and macronutrients, you're going to be able to sluggish.
And to add to that, though, if you think about it, what you put into your body, will get out, right?
Correct.
So if your gut health is not good because you don't eat properly, eat a balanced diet, then it affects everything.
Yeah.
Affects your activity level, your brain health, if your heart health. So it kind of goes hand in hand. You can see the relations. If you're eating cake and ice cream every day and drinking wine and stuff like that, after a while that will catch up to you.
Yeah.
Right?
Yeah.
So it's really just encouraging being healthy in terms of a balanced diet. That's what they basically mean.
Trying to live,
A holistic approach.
and
Yeah.
trying to live well, so you
Yeah.
can,
No pun intended.
No pun intended.
Yeah, no, and that reminded me, in secondary school, one of the things we learned in IT was GIGO, garbage in, garbage out. So I
Garbage
guess
out.
it
Same
works
thing.
same thing
It's
for
the
your
same
body.
thing
Yeah.
Correct. Now, Doc, I think you had mentioned something about type of medicine.
The antacids.
No man, she mentioned something about tea being a
Placebo.
warmth.
placebo. The warmth of the tea, and it being something that generational we kind of use when we're asking certain questions or whatever. And I say that to say that type of remedy, so what is called is
Homeopathy.
Homeopathic.
Oh,
Yeah,
correct.
so home remedies
So
basically.
as doctors, educated doctors, is there a place for homeopathy versus like Western medicine? And what's your take on that?
I'll take this on. So,
Take it.
right, so homeopathic medicine. What I can say is that, as we mentioned earlier, something at some point in the past would have worked for somebody, right? So therefore, they would have this spectrum of bushes and teas, from fever grass down to nani juice and all
Honey
of
goat weed.
Or
this
goat,
everything,
Yeah,
right?
yeah,
So
yeah.
it has over the years has been somewhat commercialized. Now you can go to the pharmacy or
And
go
get
to
it dried
and
and-
get the dried
yeah.
leaves or get it in a tablet form or something, right? So there obviously has been some kind of evolution and some kind of progression of these remedies. The challenge that we have, and this is the significant difference between Western or traditional medicine versus homeopathic medicine, is that there is evidence to support Western medicine. There's evidence, ongoing studies. There are large organizations that do trials and clinical trials, and these trials, and there are different levels to these clinical trials. So when you see something comes out of a clinical trial, just know it has been tested in animals, and then it also has been tested in human beings as well. And tested means that these people volunteer themselves to be tested and they are paid. So some people's jobs are to be test to allow medicines to be tested on them. So when you get it always distributed to the general public, there are evidence to support what is being done, and that is in regard to the pros and the cons, as in what the positive effect you should get, as well as the side effects of the medication. With the homeopathic medicine now, the fever grass and the bush, the homeopathic medicine. Garfin, where you from? In Jamaica.
St. Mary.
St. Mary. Right. Born and grow.
Born and grown.
Highgate. I'm joking. But, and Dr. Fairclough is from
St. James.
St. James, right? Western side. The fever grass, or give me an example of something.
No, Doctor.
Honey goat weed,
Yeah,
whatever.
push it now.
let me
But I'm
give you
saying,
an
I
example.
come from country, but
But
I
I'm
leave
saying-
very early, so I really
Yeah.
don't know. I know minty.
Minty. All right.
Okay.
So the minty in St. Mary may be a different concentration of the minty in St. James. So when you see you mix a cup of nice minty here, what concentration of minty you getting in St. Mary versus down there? So meaning that it may not work for you, it may work for him. You just don't know. There are so many inconsistencies with the homeopathic medicine. I am not going to sit here as a hypocrite and say that it doesn't work. We just don't know the extent in which it
Yeah.
works. Right?
Yeah, so it has to be formulated and tested.
That's the
basically.
bottom line.
I think that brings us to the point that persons, I think it's probably Caribbean, think the doctor is trying to deceive them because they think we want them to buy into the Western world.
Yeah, and the whole pharmaceuticals
And the pharmaceutical
stuff.
them will try to hold me down and them will put stuff in my body and them this and them that. COVID is a perfect example, the COVID vaccine. We won't talk about that.
It's a different subject matter. Different subject matter.
But this information is out there. You can see the trials. You can see what has come out of the trial, what the side effect profile is. And for instance, drinking garlic lowers your blood pressure. But if your blood pressure is 200 over 140, the likelihood of that bring it down to normal, which is 120/80 or 130/90 if you're hypertensive, is quite unlikely. And remember, you don't feel it most times that it's high.
Yeah.
So you're taking the tea and you think, boy, I'm good and I feel great. But it's there mashing up your body, mashing up the blood vessels, the heart, until you reach a point where you just collapse. And then
Yeah.
you're like, wow.
And
That's
then
true.
brings me back to my question: how much garlic do you use? If
It's
you're
true, 'cause garlic for you different from the amount of garlic.
how much
I
garlic?
might use one peg versus
2
No,
pegs.
I'm really, really sick, so I need
You
6
need
pegs
6
of
That's
garlic.
right.
Yeah.
Or your
And
blood,
not how much?
your blood pressure is 220 over 140.
Correct.
Yeah.
Am I going to supermarket and buy four lines of garlic and then crush them up and boil them together because I need a higher dose?
Yeah.
So what is that higher dose?
Yeah, and I think even more than the potency of it, it would be the frequency. You know,
Exactly.
traditional medicine says take twice a day
Twice
with
a
a
day.
meal,
Yeah.
but you drinking this guy every time you drinking a
You're
sip,
drinking.
and then one day if you fall down because your pressure too low because you actually have no way of saying, okay,
Measuring what-
can't
yeah,
regulate
this
it,
is
yeah.
working.
Must-
And I'm not saying again, I'm not going to be a hypocrite and say it won't work because I'm pretty sure it does. But I think we just need to be a little more careful because there's nothing wrong with getting a professional opinion. I feel like if homeopathy was everything, then medicine should not be a field.
Yeah.
You know, like it should have no doctors.
But then, to be honest, at this point now, it's all being bottled into one thing. So doctors are
Homeopathic doctors, that's true.
Doctors too. So it's kind of integrating everything now. So gone are the days when you're like, don't try that, it don't work. You can consult with your doctor still, get advice,
Yes.
and you work around a plan.
Exactly.
And if
I love
I
that,
need
yeah.
help with that plan, I call somebody who's in the homeopathic field. I call a dietitian, a nutritionist, a physiotherapist, and we collaborate.
Okay.
Yeah.
Yeah,
And
I
I-
love that, yeah.
I tell my patients too, I say, listen, what I know about and what I was taught in school rigorously for an extended period of time is this. I can tell you about this professionally. I cannot tell you about how much garlic to eat. I can't tell you if to drink the garlic tea in the morning and then put 2 extra cloves of garlic in your food and then put it in your sandwich as well. I cannot tell you about that, right?
Yeah.
But I need you to, your blood pressure is this, and I need you to take this medication, or else the consequence of you not taking your medication is a heart attack and a stroke. And depending on where it is now, you have to take 2 of these medication. When your blood pressure is 180 over 90, show me the script to tell me how much garlic they have to use.
Yeah.
I don't know. I honestly don't know.
Yeah.
And just to kind of segue, no, it's more than just blood pressure. Blood pressure can kill you silently right away. What about things like cancer, like breast cancer? I've had young female patients. We're talking about the early teens, and Dr. Fairclough can testify to this too. They come on with a breast lump, and the breast lump is there. It is retrievable. We can take it out, send it to the lab, and test it, see what type of cancer it is, so the patient can get a very specific chemotherapy. But they opt to do homeopathic medicine, meaning that the bushman. They go to the bushman. I know commonly they go to a particular parish on the eastern side of the country. And, we don't want to offend anybody here. But, and they start the bush therapy. And I've seen with my own 2 eyes, this patient went from having a normal breast to having a very cryptic, and let me tell you, cryptic hyperpigmented, meaning that dark areas with little holes in there. And I'm trying to create this vivid description for you. And this now has lesions across the chest wall. And it's oozing. It has a bad smell to it. And they have to use a lot of gauze and stuff just to keep it tidy.
And the lump?
Right?
And the lump?
And the lump has
It's still
now
there?
invaded the whole... So
The lump is not part of the chest wall.
yeah,
Oh, I
it's
see.
hard. It's like
no
bone,
gone.
you know?
Yeah.
And it's just oozing little pockets like a volcano. Just imagine little volcanoes and little volcanoes in the person's chest that oozing pus and blood.
And they're still taking homeopathy.
And they're taking home and they're saying, Doc, it's the medicine that's causing it to mash up like that. It's breaking up. It's breaking it up. And I'm saying, can't you see that you're losing weight? They said, Doc, that's part of the process. The bushman told me that that's part of the process. And I'm going to lose weight for now. My blood count is going to go low. I'm going to start getting a fever and it's going to start to smell bad. That is the toxins from the cancer leaving my body. And I almost feel bad saying this now because it's against what I know.
Yeah.
But these are the words that the patients
And
use.
it's how they justify.
But
Correct.
justify. And,
Yeah.
then
Wow.
even worse with
Yeah.
that is that when it then doesn't work, this person who was advised them is not going to be like, well, you could not have been saved, or there was something, not to knock anybody, but there was some spiritual reason why you
it
could
didn't
not
work.
have been
So that's their fail safe. That's
So
their
do
fail
they
safe.
then turn to traditional medicine?
Absolutely.
sometimes, but it's too late.
Too late. Yeah.
So when I could have taken out that lump for you, now
And you could have lived a normal, happy
follow
life.
up the life every year with a follow up, make sure
Yeah.
everything is okay. But now I literally cannot do anything for you. But there's something in this specific situation. There's something called, in some instances, what we do, we call a toilet mastectomy. Just imagine a toilet with a lot of feces in it. That's just nasty. And so we just have to just flush the toilet. Meaning that what we do,
off everything.
You
we
just
just
remove
take
it.
off everything. But that is not the intent. The intent there is not to cure. The intent is just to allow them to live a life
life.
that,
Longer life.
Yeah.
whether it's a couple months, a couple of years again, that's just kind of reasonable and humane.
Yeah. Yeah.
And this, and it goes further because And it's kind of what makes the job tough, because then you reach a point where the person comes and they are basically, you cannot save them.
Yeah.
And they do say they pass on. What happens is that you, the doctor, is blamed. You know?
Yeah.
Nobody says, but
They
10
never
months
come,
ago when you
yeah.
came, we said this and you told us, no, you're going to try something else. But then the last where people go and die is the hospital or at home. So when you come, it becomes a big thing that, no, she did all right. And she got doctor and then she just draw down and she died.
And that's why it's important to document too, because as he said, we are here spreading health awareness, health education. But there are lawyers out there who say, "Oh, pick me. I will represent
Yeah,
you."
too.
So there, as while we're here trying to promote health, there are lawyers here. There are lawyers who are in training right now, coming for your license.
Yeah.
You know, so that's why it's important just to document everything. Have family
And to make
discussions.
informed decisions.
Make
Yeah,
informed decisions.
have family and have not just that, because you spoke about informed decisions, and that's actually part of it, like in the whole consenting process, where we evaluate the patient's capacity and ability to comprehend what we are saying, right? And breaking it down to their level so that they understand what's really happening and the natural process or the natural progression of the disease.
Yeah.
Meaning that what will happen if you don't do anything at all, this and this and this will happen.
Yeah.
Right? We have had patients who come, they try the homeopathic medicine and they deteriorate and they die. I've had patients who come and don't do anything and they try believing in a higher power, whatever that higher power is at that time, and they die. Right? We've had patients as well who come, they did what we recommended and they survived. I've also had patients who did what we recommended and still tried the homeopathic medicine and they survive. So I'm saying that I tell my patients, and we tell the patient, if you choose to proceed with the natural medicine and you choose to proceed with our medicine and you survive, they say, "Doc, I really think it's natural medicine." I say, "So be it, no problem.
Yeah.
Whatever
survive.
makes
At this point,
whatever
it doesn't
makes you
survive.
sleep
Yeah.
well at night,
Yeah.
you proceed
Yeah.
with that thought." But
Chances are.
chances are, right?
Yeah.
And I can tell you from other patients. I say those who did it alone didn't work. They said, "All right, Doc, maybe it's both of them together. They mix up
Yeah.
and they had a nice effect." I say, "Sure, no problem.
Yeah.
Whatever
floats your boat.
Yeah,
Yeah.
let's proceed with that. You know."
Yeah, and I think it was important because I think you mentioned the fact of talking to your physician, like including them in this. I feel like that's the end all and be all of it, because these stigmas exist, these misconceptions persist, not persist,
Exist.
and culture has a big role to play in it, but there are ways to get around it. Nobody's saying to shun your culture. Nobody's saying to say that, tell your grandmother you're not making sense. Nobody's saying that, but have that open conversation with your physician. Don't be afraid to, reach out to them. Have your own personal physician if needs be. And
Yeah.
how
But
often
I
is
think
supposed to
the issue
see?
is that there's a misconception that your doctor will judge you. And it's probably not a misconception. In
Yeah.
the past, and to some
They probably
extent, they
are
would have
some.
said, be very rude in
Yeah,
their response.
yeah.
But now we're realizing that some of the alternative stuff do have some evidence, and you can kind of
Integrate them.
collaborate and integrate them
Yeah.
into care. But what is not the response is, me not going to the doctor, me go to somewhere else and figure it out. Include your physician in the discussion.
Of course,
Let
yeah.
them say, I don't agree, and you say agree, and we document,
Have
we
a good
find a way
discourse.
around
Around it, yeah.
Right?
No, I agree.
Yeah.
Okay.
I agree.
And with that said, and before we wrap up, because we have a fun game. We have a fun game that we're going to play. But before that, there's one very important question I want to find out. I know Sasha and I were debating, going back and forth about it.
Yes.
But as a doctor, do you know when I'm lying as a patient? If so, how do you know? What are the cues that you probably see?
Again, I think it's easier to determine between lying and being anxious. It's difficult, right? But when we take all the factors that will basically when we take all the elements around the patient that can cause them to be anxious, i.e., if there's a spouse in the room, or if there's a parent in the room, or if it's a kind of public setting, or they're not comfortable, if you eliminate those external factors and you notice certain behaviors or certain pattern of conversation, then you can determine if the patient is lying or not. But again, anxiety and lying kind of overlaps at certain
that's in line
point,
between
right?
the two.
But in terms of once we eliminate that, and I sit down with the patient now, and I am seeing something in front of me, evidence. We just do the STI panel, and we are seeing positive. Syphilis, gonorrhea.
You know that what we don't do
Right?
nothing.
Yeah.
You say, Doc, listen to me. I am celibate. I am celibate for the last 10 years, and I haven't had any partners in the last 10 years. But Doc, I woke up this morning and I am having this burning and this itching and the smell, and I am there's pus and the test is positive.
You remember one of the myths is that you could get STIs from a toilet seat. So maybe there is a public toilet, sat on it, and
As Dr. Fairclough said, let me just debunk that
Debunk
quick and
that.
fast.
Yeah.
Quick and fast, right? I'm looking at the camera.
Yeah,
Absolutely
not.
not. You cannot get an STD from a toilet seat. All right?
Okay.
Yeah.
And it's fantastic that you should say that, because the fantastic segue into the little game that
Wait,
we're
no.
going to play.
One more thing I want to know. How often are you supposed to see a physician? How often?
So how often? I should ask. That's a good question, right? When we speak about seeing a physician, we're talking about general wellness visit, or are you trying? So
yeah.
I'm going to pun intended here. Are you trying to get well, or are you trying to live well?
Or are you trying to be
Be
well?
well.
No, I think generally, like, let's say somebody who may not necessarily be sick, they don't
Right.
have, let's say, something that requires
Immediate
checkups.
attention.
Yeah.
Well, I
But,
think most times, so most screening, and that screening for any kind of cancer or chronic illnesses like hypertension, diabetes, you could roughly say 40. So when you're less than 40, you should ideally go to your doctor at least once a year.
once a year.
Just get a general checkup, make sure everything is okay, do blood tests if necessary. But when you have passed that age,
Make my doctor too much.
when you've passed that age, it should be more often, because
Okay.
now you might have hypertension, maybe at risk for another diabetes, you may be obese and need help with the diet and exercise. At that point, it becomes more frequent. So it can be every 3 months, it can be every 6 months, it can be even more often if you have like a cancer or something that
Right.
needs immediate management.
Okay.
But anyway, definitely 2 or 3 years shouldn't be going by and you're not seeing a
Seeing a
doctor.
doctor.
Right.
Okay.
And I
No
just
matter
want
how young or old you are.
Right.
Okay.
And I just
Okay.
want to add into that. That's where the whole collaboration comes in with you and your doctor. So if you go to the doctor this year, right? For the first time you're going to the doctor take a nice detailed history, just like we're sitting here and talking, and doctor has time and we sit down, we just kind of give you a nice environmental to open up, and we evaluate your lifestyle choices, whether you smoke every day, every week, marijuana, cigarette, heroin, LSD, anything at all those risk factors, whether your lifestyle is that of a risky person, right? Whether it is, you involve different groups and, high risk groups and those things, or whether it is you have a family history of certain types of cancer. So whether it is breast cancer, prostate cancer, colon cancer, and that initial assessment, as you say, would give you an idea of when. So
okay.
you may be the person who have to wait until 40 to start going to the doctor every year,
maybe earlier.
or to get screening, but you might have to start screening at age 35, right? So that will basically provide the lady framework for you to determine how long or how frequent rather you should be going to a doctor,
Okay.
and take it from there. But just like how you won't let your car go
You have to
more
service
than a
your car.
year.
Yeah, of course.
Right?
Please
Service the
don't
car.
use that
Right?
example with me.
No, because I
I'll
know.
never-
Last you service your car.
I'll never visit a doctor.
So you won't let your car go an entire year without being serviced, because listen, although they said every 5,000 kilometers or every 3 months, right? Most of us don't take that on, right? And then we go at 6 months, and say, hey, my car trunk,
Trunk.
my car trunk, right? So it will last, man. It will last, and 6 months pass, you're fine. A year pass, and the car, you say, all right, let me go now. When they check in the oil black, the transmission fluid clog up, right? So I'm saying that to say you may not experience
Right
any
away, yeah.
symptoms right away. You might even be able to squeeze out 2 years before you go to the doctor. But I guarantee you, repeated action
Yeah,
will catch
it'll
up
weigh
to you,
you down.
and you'll be trying to get well at that point in time. You'll be trying to be well.
Yeah,
right. So now we just have to try and live well.
I love that. Okay.
Fantastic. So now we're gonna segue into a game. We say it's fact versus fiction.
Okay.
And the first one I'm gonna ask, I'm pretty sure we know the answer already, because we
Like a
literally
school
just
science
talked
quiz,
about
it's
it.
like
Yes. I wish we had buzzers.
I know, right?
Really like
Trust me.
Yeah.
So the first one, A primary care physician is someone you only see when you're sick.
We just
But we
spoke
just
about
mentioned
That's
that.
what I'm
Yes.
saying.
Okay.
False.
Okay,
Nice.
second one. Any healthcare professional can perform primary care.
When you say healthcare professional, what do you mean? What, doctor? Because a nurse is a
Or
healthcare
let
professional.
me rephrase it. Sorry. Any health professional
False.
can perform primary care.
False. But it's to an extent. That question is
I know. That's
Tricky.
why-
Right.
I know.
So
that's why I asked.
because our friend here, Sasha, she's and permit me to share, right? So she's in health as well. She's a health professional, right? Health management, public health. Those things are what we call on the primary level. So she's about primary care intervention and preventative medicine, basically. She's not a medical doctor,
Okay.
but she's a doctor in her own right.
Okay.
So can you repeat the question?
Any health professional can perform primary care.
a
I
clinical
wouldn't,
doctor.
I wouldn't say
A
primary
clinical-
care.
clinical.
I would say primary intervention, but not primary care.
No,
So she can go into the clinic.
No, doc,
Is that true or false?
That's true there. When I'm getting to the technicalities
No,
of it
man,
now.
we have-
And I'm going to say this to say,
False.
False.
because from my perception, and you can tell me if I'm wrong or not, isn't a vet a health professional? as well?
Absolutely.
Then answer the false, doc. We're getting technical with me for.
Absolutely, but I guess I was in human medicine. But okay, so the answer is false. However, I want to employ all the health professionals out there to, if you see something going wrong, by you simply encouraging
Encouraging,
someone to go to the
correct,
doctor,
correct.
encouraging someone to stop smoking, encouraging someone to stop being promiscuous, encouraging good health practices,
Yes.
exercise and diet, and just generally living
Yeah,
well.
yeah.
That
Okay,
is
that's true.
intervention.
All right.
Yeah.
Fantastic. Thank you. Third one. A primary care physician's referral is usually needed before seeing a specialist.
The word usually makes it true.
But if you take out the word usually, it is a different answer.
Okay. All right. Then the last one. I don't need a primary care physician.
You're crazy.
You're great.
Okay, but why?
Well, I think we mentioned it earlier is that you are good until you're bad, right? So, perfect example was the car. You're going with the car great until the car shut off on you. You cuss the car was never good, but the car was doing its best without the servicing, right?
Yeah.
So you do need a primary care physician because your health and wellness is your wealth. That's how you work. That's how you build your family. That's how you make money. That's how you survive to 65, 70, 80, 100. By improving how you eat, improving how you exercise, and seeing your doctor to get checkups to
Yeah.
know what's wrong, what needs to be adjusted.
Okay. And there you have it.
Wow, I think
it's
a great convo.
I
Yeah.
know.
Wow.
I think we got a lot of great nuggets again. I want to
definitely.
thank Dr. Fairclough, Dr. Charles for joining us. I think it was a riveting discussion. I mean, it's one that, again, we've all been in situations where we have something that happened to us and we need to talk to somebody, we need to say something, and we feel scared. We don't know how to approach it. I think the doctors did a lot today to debunk some of the myths that we've had, that we grew up on, that are intergenerational, that has stuck with us. And it's something that we don't want to have. And I think that outside of that, they also spoke about the bridging the gap between, or what social media helps
Yeah.
to do in terms of the information that we get and how we can relate to our doctors, which is very interesting and very eye-opening and headline. I want to thank them for that. So,
Definitely.
yeah, it was a bit a good one. We played the
Yeah.
games. We got the information. We
did.
now know how to address awkward situations. It's
Yeah.
from a place of openness, honesty, and just from a place of wanting to be better.
Yeah.
A place of wanting to
Yeah.
be well and live well.
Yeah.
And on that note, I'm going to say thank you so much for joining another episode of the Live Well podcast. Fantastic discussions. And until next month, where we have another guest, another unique and superb topic.
Yeah.
I'm going to sign off.
Wait,
from my
before you sign
co-host.
off, and tell them where to find us.
Oh, so I remember
Guys.
you said that you
Sorry.
lead in this, so slash.
Oh, I did.
Uh-huh.
So, guys, Okay, no, but seriously, we really want to thank you. Just echoing what Garfin said, we want to thank you for joining us. If you want to stay connected, I mean, we still have some more episodes to come. Check us out on YouTube, Facebook, Instagram, Twitter at Nestlé Caribbean. Also,
And docs, where we can find the
Yeah.
doctors? Yeah.
what?
Oh, hey, I'm at HYC Medical Limited in Kingston, 70 Halfway Tree, and we're on all socials, HYC Medical JA.
Okay.
All right. And I am on social media at ejay.868. And you can reach me on 279-3169. But I work publicly. Right?
Excuse me. What is the area code for that number?
Oh, that's Trinidad.
I knew this was coming.
But that's my Instagram handle. You know, you can find me there.
Okay.
And I'll be willing to give any advice, any necessary. You know.
Yeah, and guys, I mean, Google resources. The resources, look, your ministries of health, they have pages with resources, physicians, clinics, anything you need. I mean, we live in a very digital age where everything is literally at your fingertips. So don't let your health go to waste because you're lazy. Look for it and, take some action.
That's right.
Yes.
That's right.
All right. So until next time, guys.
Until next time, take care.
Take care.
Thank you.
Bye.
Bye.